Calling on Daisy. Calling on Daisy. Hello, ladies and gentlemen, friends and colleagues. We would like to invite you to come to our talk show, sponsored by Unzip The Lips. Unzip The Lips is a movement of activists who care about ensuring that the voices of women and girls are heard. It is a platform where we enable those voices to engage in conversation, in advocacy, and in discussions about the issues important to women and girls. In particular, we are talking of women and girls who are most at risk and who are affected by HIV. So this afternoon, we are very lucky to have wonderful people to join us here. The topic for today is gender equality in concentrated epidemics. In Asia and many countries in Latin America and even in Africa, many of the epidemics are concentrated. And so it's a totally different concern and totally different issues compared to generalized epidemic. So this is our topic for today, and we are lucky to have with us as panelists four wonderful women who are very strong in their own rights, who are activists, and whose voices we hear most of the time because they are out in the front of the fight. First, we have Daisy David of the International Community of Women Living with HIV Asia Pacific. Then we have Natt Kraipet of the Asia Pacific Transgender Network. We have Tracy Tully of Asia Pacific Network of Sex Workers, who we hope will join us very soon. And finally, we have Nini Pakma of the Asia Network of People Using Drugs. I'm Jet Riparip of the International HIV/AIDS Alliance, facilitating this afternoon's meeting. So I would like to start by asking our panelists here to describe themselves in one sentence. I know it's easier to ask people to describe themselves in 10 sentences, but one sentence is what we are asking from them. Shall we start with Nat? Nat, in one sentence, how do you describe yourself?
That's hard. Well, I am a transgender woman living with stigma and discrimination for my whole life, fighting for transgender community.
Okay, spoken like a true activist. Okay, now let's ask Nini. Nini, describe yourself in one sentence. I think it is better to do that. Just wait and pass on.
Uh, I'll describe myself that I'll try to fight, for the rights of the women who using drugs. Thank
Okay,
you.
again spoken like a true activist. And now let's ask Daisy David to
Good
describe herself in one sentence.
morning.
Daisy.
I am living with virus. I am a woman living with HIV/AIDS. Enabling women living with HIV/AIDS.
Okay.
In Asia Pacific.
Empowerment. And Tracy. Tracy Tully here is with the Asia Pacific Network of Sex Workers. Tracy, I just asked them, describe themselves in one sentence. How will you describe yourself in one sentence, Tracy?
Hello, I'm Tracy, and I'm a sex worker, and I work at the Asia Pacific Network of Sex Workers.
Okay, thank you for that. Maybe, Tracy, you'd like to move your chair a little bit so people can see you? Okay, thank you. Now, this is a talk show, so we're not gonna have presentation, except later we might be able to show you some slides. So what I'm gonna do now is ask each of them to tell us what it is that they are very passionate about in our work as women, empowering women and girls' rights and opportunities or lack of, in a concentrated epidemic. So I'd like to start with Daisy. Daisy, would you like to tell us?
Hi, I came from India and I am representing ICW Asia Pacific. And as a woman living with HIV, my concern is like sexual and reproductive health of women living with HIV. And rights comes of, apart from sexual and reproductive rights, and women basic rights and their children rights and adolescent girl children rights. And talking about SRHR, sexual reproductive health rights, it's that access to SRHR services is comfortable, we can say, but when we are seeing in research base, it's not comfortable, it's not reaching into grassroots level in interior part. Though this major initiative taken by government countries in Asia Pacific region, but the level reach in this deep interior is very not satisfactory, and illiterate women are there, and cultural taboos are there, and fear is there, and lack of information and lack of knowledge. As because of this so many factors, women living with HIV, age factors, adolescent girl children, young women, aged women, and everybody, they are coming in this health, starting from their puberty up to their menopause, living with virus, accessing services. It's not that much comfortably they are taking their rights and their health. So we from Asia Pacific region, along with some NGOs, INGOs, World Vision, Alliance International, we are taking part and integrated with them with the National Positive People Network, and we do some trainings and capacities to the people living with HIV, especially women in interior parts.
Okay, okay.
As because of their trainings and capacity, we are getting some good outcomes and some challenges, which I am telling in the second round. Thank you.
Okay, thank you, Daisy. Shall we ask Tracy to tell us a little bit about this fight, particularly focused on SRH? I know many people drop the R after SRH for comfort level, but I think these women will not allow that to happen, right, Tracy?
Of course, the rights part is the most important part of the whole sentence, because that's what we advocate for, is for rights-based programming for sex workers as a key affected population, and also for sex workers who are HIV positive.
Okay, thank you, Tracy. Shall we ask Natt?
Well, for the transgender women, the most important thing is that we are invisible because we are not recognized legally. Right now, there are not many countries that recognize transgender women legally. For myself, I'm from Thailand, where there are a lot of transgender women. However, the official documents of my gender might still Mr. That is very hard for me in terms of accessing healthcare services. When a transgender woman go to the hospital, there are a lot of stigma and discrimination. And the stigma and discrimination, it's just like a negative action from the service provider. You know, when we go to the hospital where we are supposed to get tested, where we are supposed to get a treatment, it's just hard to go there. For myself, I am not afraid of HIV. I am not afraid of people living with HIV because I have a lot of friends living with HIV. But I am afraid of going to hospital.
Why? Why?
A lot of stigma and discrimination.
Okay,
They are not
okay.
recognize me. And as a gender mark as male, when you go to the hospital, if it's not a private hospital, it's not an expensive hospital. When you go to like a public hospital, you will send to male ward. And just imagine what happened to. You can imagine what would happen to a transgender woman who was sent to male ward.
Okay, okay. Okay, before we go to Nini, I would like to just ask Tracy to explain a little bit about what you said about the things that are happening among sex workers at the moment. particularly related to the dropping of rights?
Well, there's all sorts of HIV programming for sex workers, and not all of it is based in human rights, and that's part of the reason that we advocate so heavily for it. One example would be the USAID PEPFAR pledge, where grantees of USAID PEPFAR are obliged to sign the anti-prostitution pledge, which basically where they say that they won't promote prostitution. So working, for instance, handing out condoms can be seen as promoting prostitution. And so we don't believe in this model. We promote rights-based programming, and we believe that sex workers are the experts on their own lives. And it's the same with everybody, you know, all our communities. We know what's best for us because we're living it.
Okay. What about access to services for SRH? How is that for sex workers?
Well, there's a lot of stigma and discrimination in healthcare settings, and so sex workers are often reluctant to identify as sex workers or to access health services. And if they do, you know, they don't necessarily access the full gamut of sexual of SRH services, and this is something that has to change, and that's something that we all lobby for as part of the Unzip The Lips platform.
Yes, of course, of course. Thank you. Let me ask Nini, without the slides, without. Let me ask Nini. Nini is with the Asian Network of People Using Drugs, and maybe it's as challenging as the others. I wouldn't say it is less or more challenging, but let us hear from her about issues concerning SRH and other challenges faced by women who use drugs.
Actually, a woman using drug are most high risk and vulnerable. Because if we look from the harm reduction, that harm reduction is neglected. I mean, in the package of a harm reduction, it's neglected for the woman using drugs. And apart from that, a woman using drugs share injection equipment, and they are almost second on the needles, because this is, I feel like, why I said that they are always second on the needle, because I found it through my experience that when I still using drugs 14 years back, so 5 years continuously I was injecting drugs, and whenever I share injecting equipment or stuff with my friend, so most of the time, so I'm always will be the last on the needles, because this is one, like among a group, if we have male and female group, so the female, they always last on the needles. And apart from that is some of the women using drugs, they become a sex worker also, to generate, to get, to support their drug use. And some of them, because the partner decline is it's come down, so they support, to support the family, they have to go for the sex works. And some of them, they exchange sex directly into drug. I mean, into drugs. And the majority of the clients in the harm reduction program is males, and it's very difficult for the women using drugs to come to seek the services of the harm reduction, because the harm reduction program is tailored to meet the needs of the male drug users. And male partner also. Some of the sex workers, they have a male partner. The male partner discourage the women drug users to seek services from the service provider, from the treatment center. Example, if the woman drug users infected with STI, but the partners of the females drug users, he discouraged to seek help from the health service.
Oh, okay. Well, let me just ask a question, a follow-up question to you, Nini. When you said that you're always second or the last to use the needle. And because of this macho thing, is that still going on? What do you think? Is that still going on today?
Yes, I'm not seeing that across the country, but some of the state is still going on. I mean, in my states, like I have seen most of the my friends who still using drugs. When I went to, I mean, like we found that they still share that they are the last one who'll be on the needles.
Okay, thank you. Okay, Daisy, you talked a while ago about SRH services not reaching PLHA, women who are living with HIV, because of taboos, because of cultural difficulties. Uh, so what is the current situation now? Has there been any improvement, or what is your network doing to ensure that
Yeah.
this doesn't happen anymore?
It's like a country like India. I cannot able to say on other countries. Specific to country like India, there is initiatives taken by this national community networks, and they are coming with some advocacy, strong level advocacy for policy for this cervical cancer pap smear. But still it is not an implementation part. And some INGOs and NGOs, they are working hard to empower the women. But the key challenges faced is like this coast sterilization and abortion. It's starting in this cultural taboos as because of that, and it start in this rural part. From the home, from the in-law side, it started. And the women living with HIV, they couldn't able to come out that they want to go for sterilization and they want to go for abortion. And coming to the hospital setup, women, they want to get pregnancy also. Medical practitioners is not encouraging them to go for pregnancy. This is still it is happening. But one side we are seeing that supportive programs is happening, supportive interventions is happening. So that only all these networks and NGOs and like alliance and community organizations, faith-based organization, they empowered women. So that only in reproductive health part and reproductive rights part. So unless until if they are not feeding the information and knowledge on starting from their puberty and adolescent girl children and safe sex practice, and also talking about this hygiene management, because India is not developing country. Our women living with HIV is getting just like 3,000, 4,000, managing the whole house. That everybody is living in a very rented house. This environment and infrastructure of this house setup, everything is not that much very comfortable. They are poor and poverty, and so managing their level of accessing ART and also things like that, it is not possible. So providing that information, knowledge, we are taking an initiative, but we look support from the government also. Even government, they are trying level best to support us, but still we are facing the challenge to reach to this interior level. This is what one said. And coming to the end of this cervical cancer, what is cervical cancer? What is cancer in vagina? How it is? It is not possible to confirmly we can say that people they can have AIDS. And because lack of understanding and lack of knowledge, and because of the fear, even in my experience, I didn't go for pap smear. I am basically 10 years working as a lab technician, but living with virus for after 10 years, I didn't go for my pap smear because my fear, I don't want to see another positive result in my life.
Okay.
So that fear, how government programs to compete that fear to go for the diagnostics and ongoing motivation and counseling. Everything is there in these guidelines and they are doing. We cannot say that they are not doing, but the level it is not reaching to the grassroots level.
So it is the women
It's the
who
women.
are not...
And women coming in the sense, we are taking care of the women living with HIV, adolescent women, women widows, sex worker women. And coming to the part of menopause, we are taking the above 45 to 50 women also.
So
and transgender women is also part in our programs to take care of our STI infection. So it is
Daisy,
integratedly, we are looking for their support system.
okay. So Daisy, what we're hearing from you is that sometimes it's also the women who are probably scared because they lack the information, they lack the knowledge. So I hope you ladies have gone for your pap smear, okay? Now, let us ask Nat, because I think transgender people have a little bit more difficulty when it comes to seeking care, as you said, in hospitals and clinics because of the, I don't know, is it ignorance? Is it lack of information of the providers? But so what is happening there, Nat? And what is your organization doing to correct
First of all,
that?
it's just because the lack of information and research on specific transgender issue. When it comes to the HIV issue, transgender population are always included in the MSM, or men who have sex with men, which we are not. Look at me, do I like a man who have sex with man? I am not a man
You
who
look
have
sexy.
I am not a man who have sex with man. A man who have sex with man is a man have sex with man. But transgender, we are more than that. We have to get through the transition process. We have to take hormones. We have to face different kind of stigmatization and stigma or discrimination. When it comes to the HIV prevalence data, there's no HIV prevalence data specific on transgender. We are always put under MSM umbrella.
Yes, yes.
And that's why it's just like an excuse for the service provider as well, that they didn't have information, so they don't know what to do with the transgender people.
Is it the same in Thailand? Because we all know that Thailand is one of the more progressive countries when it comes to transgender, and many people from all over the world come to Thailand for that. So is it still the same in Thailand?
It is still the same because like one or two, I think last month, the Ministry of Public Health in Thailand just launched a website on HIV database. And when I go onto the website, there's no information regarding to it, HIV prevalence of transgender.
Oh, okay, okay. I'm sad to hear that. Okay, let's go back to Tracy. I think Tracy's work is one of the more challenging ones that we know. One of the issues that is raging among sex workers and supporters of sex workers is being able to discern properly whether a person is going into sex work because she wants or he wants to, or whether this person is classified as being sex trafficked. So tell us a little bit more about that, Tracy.
Well, the trafficking organisations that run now actually conflate sex work with trafficking, and it's causing all sorts of problems for sex workers, and I imagine also for people who are trafficked, because there's all sorts of shoddy data out there, and there's a lot of money flowing into the trafficking organisations, even HIV funding that really should be going to sex workers. So that's one of the things that we do at APNSW, is we try to dispel the myth that conflates sex work with trafficking. It's a
And
big
how
problem.
is it coming along? Do you have more people believing in that you should discern between the two? They're not one and the same.
Well, the tide's certainly turning. I think that the abolitionist feminists certainly they had their hooks into sort of what you'd call mainstream feminists for a number of years, but then they had a lot of money and flowing into the anti-trafficking organisations. But I think that mainstream feminists are starting to question the dominant narrative that says that sex work by definition is violence against women.
Okay. Now I'm going to ask them for the next round a question that is very dear to all of us, and particularly for women and girls who are the main focus of Unzip the Lips, and this is funding. I think we are all stymied by the fact that donors are leaving because they say 2015 is coming. You have done so much already without really looking deeper into what are the needs of women and girls and other communities, of course, when it comes to HIV. So I'm going to start. I would like to start with Natt here and ask her about what is the funding landscape for transgender people.
Actually, the the donor haven't really started investing on transgender people yet. For a long time, it has been many years that transgender people are under MSM umbrella. Every time when the fund comes, it comes through the MSM issue, and then just a little bit part of the fund came to the transgender community. So they cannot say that they're going to stop the fund for HIV or women issue because actually for the transgender people, we haven't get started yet, seriously started yet.
Okay, so you think that there is a good horizon out there for transgender
Yes.
people? Okay, that's good news. I mean, that's one good news. We hope to hear other good news. Okay, what about you, Nini? What do you think? How is that? What is the funding landscape looking like among people who use drugs, particularly women?
Okay, in my country also, the donors have, I mean, like they have the line, I mean, for the services for the women using drugs, but the services is not to meet to the need of a male using drugs. It's based on a male gender specific. It's not on a female gender specific. So this is what we feel like that the harm reduction program, of course, is there for the woman using drug, but it's not. There's a package that is not there specific for a woman, like reproductive health, nutritional supports, mother to children supports. So it's not there. It's only about treatment and the needle syringe exchange program, condom. That's it.
Okay, so we need more work to actually advocate for more women-friendly services in harm reduction.
Yes.
Okay, and are you seeing money going into that? What do you think? Or are they just lumping it all together into harm reduction, period?
No, actually, I haven't seen money, but actually the program is running. It's already started.
Yes, yes.
We have already have office also, specific DIC also for the women using drugs.
Uh-huh.
But it's just because that the services is geared to meet only for the male drug users, not for the female drug user.
Okay, okay. Hopefully, we will see more women-friendly services also, such as SRH, right?
Yes, yes.
Okay, okay. Let us ask Daisy. Among women living with HIV and SRH, are you seeing? Do you see? Are you positive that there will be funding to come to support you, or is it a blah blah landscape out there?
I can say that it's a question like, but we need fund for that, concentrating more on sexual reproductive health rights to be a main package because it is not lying down. It should be a comprehensive package. It's not happening. People are thinking that SRHR is separate pack. No. SRHR linked to ART, ART linked to maternal and child health, maternal and child to PMTCT. Everything to be a comprehensive package. Unless until funds to be flow to everywhere, it should taking a special concentration in terms of SRHR. And also post 25 to the 2015 agenda, HIV to be there. It's in terms of key population violence. But I am telling that reproductive health rights is for ID women, transgender women, sex worker women, women living with HIV, family women, everybody.
Okay.
Women in the sense it's not only program level, it's linked to this prevention and to the care and support. So that only we can reach 1990.
Okay. At this point, I would like to open the questioning to our friends who are out here. Do you have any questions for any of our panelists related to services, related to funding, or just what you feel about it? Mona, okay. Can you identify yourself?
Hi, I am Mona from India. Just I want to ask our friend from Thailand that how are the practices? Oh, sorry. how are the practices in private sector setup? Because the government setup, women are not able to get more friendly services. So how you are sensitizing the private sector also to get the SRS services there for the trans women or female sex workers or someone?
Okay, thank you for that question. Nat?
For me, I think that I can say, especially for transgender women, when we talk about healthcare service provider and discrimination among service provider, it happened in both um, in terms of private sector and public sector. Both of kind of sector, they have not been given a proper training regarding to transgender issue. And you may know that Thailand is famous for sex change surgery, but the sex change surgery or sexual reassignment in Thailand, it is just for, it is like a business. It is a business to make the money. It is not just for the to help the people. It is business.
All right, thank you for that, Nat. So in the private sector, yeah, they are more conscious because it's a business. Now let's ask Tracy about services in the private sector for sex workers.
Actually, to be honest, it's not something that sex workers have been doing. We've been sort of reliant on public funding up until now because it's not a very popular topic with funders, but it's certainly something that we're exploring with the changing of the HIV landscapes.
Okay, thank you for that. So there's hope there. Okay, now why don't we ask Nini? Nini, what about people who use drugs, women who use drugs, who use private sector facilities? What is the experience of women who use drugs when they go to a private facility, for example?
Actually, a woman using drugs are being affected by physical, mental. I'll come to your question, but I'll just explain that first because this is the stigma and discrimination is quite high among the women using drugs. So are being affected physically, emotionally, morally, and economically just because of drugs using habit. And recently, last year, it's happened like one of the drug users, women drug users, she went to deliver the baby to the government hospital. So when she disclosed to the doctor that she's from the drug users background, so that the doctor can treat her so that the withdrawal, and then the doctor it's written in the doctor sheet or the prescription, something like that. So the nurse, all the staff out there in the health sectors, they have seen that, yeah. So because of this, all the staff of that government hospitals, they ill-treat for her. Because of the drug using background and plus HIV positives, so they deny to give her a proper treatment. So because of this, they don't even give the medicines to the child also. So after 2 days, the child was died. And then the bed sheet, the pillow covers, even all those...
Everything that she used.
Yes. So they didn't change the bed cover. They didn't do anything because they said that she's a drug user, she's a PLHIV. So they just leave it like that. And then her baby after 2 days is died. So when you said that in the health sector, being a woman drug user, it's very difficult for her to access the services because in my country, some of the states, we believe that a woman is a double divine or a mother, a daughter, a wife. So we could not we could not use drugs. And because some of the state also, we believe that they are a matrilineal society. So the stigma and discrimination of women and girl who use drugs, it's very high. Even like there's some locality also, they arrest, they caught them and bring them to the community hall and beat them till they died on the spots, because they said that they are if the drug user, if a male drug user is using drug, is it okay, it's acceptable, but if the female using drugs, that is not acceptable. This is what happened.
Oh, that is so terrible. Okay, Daisy, tell us, what about the experience of women living with HIV and private facilities? Do women who are positive go to private clinics, for example, or hospitals?
Yeah, of course they would like, they want to get a good support system to get a very good treatment. They are going private setup, and some major
They are treated well.
yeah, they are treated well, and government hospital providing services, but indirectly they will be, for example, some hospitals, hysterectomy it has to take place for some women. They will indirectly they will give counseling to go for some hospital.
Ah,
And
okay.
they will be. That is one factor. And second factor is women, if they want to, because of stigma and they don't want to treat in government hospital, it's okay if they are comfortably they can treat. They can go private hospitals. Private hospitals, not like before. There are certain private hospitals, they are giving treatment to
Okay,
women
okay.
with HIV.
Thank you. Well, we have heard the many issues and concerns of women who are affected or most at risk of HIV. And this is why Unzip the Lips continue to be a strong movement. And we hope that at the end you will join us in the fight to make sure that women and girls have the voices to express themselves and to talk about their needs. Well, thank you to our panelists, and thank you for coming to our session today.